Dear Lagosians, let me start by again wishing you all a Happy New Year. This is my first time I'll be addressing you on the COVID-19 pandemic in the new year. Sadly, the focus of this address is on the second wave of the COVID-19 that we are all dealing with, which is turning out to be a far more serious activity than the first wave. I want you to please pay attention to everything I'm about to say. We can flatten the curve and defeat this virus only if we take seriously the advice and the guidelines being issued by authority regarding prevention, treatment, and general behavior of each and every one of us at this difficult period. The epidemiological update. Let me start with the numbers. As we are aware, Lagos State remains the national epicenter of this disease. As at the 17th of January, 2021, Lagos has recorded a total of 41,374 confirmed cases of COVID-19. Of this amount, over 28,452 have recovered and are within the community, while about 9,213 are currently active in the community. Over the past 11 months, about 3,776 COVID-related patients have been admitted into our various care centers with a registered fatality rate of approximately 0.67%. To date, we have 277 fatality cases. So what's been our testing strategy? One of the greatest hallmarks of the Lagos State response has been the state's robust testing strategy. In addition to the 4 public laboratories providing free testing under the public health response, the state has increased the number of private providers under the private laboratory consortium to 20 private laboratories. These laboratories are also providing service to both our inbound and outbound international travelers, work-related activities, or anyone that is curious about their COVID-19 status. The formation of the consortium has significantly increased our testing capacity, with the state now conducting between 2,500 to as high as 3,500, almost 4,000 tests per day. So far, a total of 263,358 tests has been conducted between our public and our private laboratories, with 41,374 diagnosed as positive. This has allowed us the opportunity to target our interventions with precision and ensure the effective use and mobilization of resources. It is important to clarify once again that those that fall within the case definition, that is, have symptoms such as fever, cough, cold, inability to smell or taste, have headaches or general body weaknesses, or those who come in contact with anyone with any of these symptoms may be eligible for a free testing at any of our public laboratories. Isolation strategy. Lagos State recorded a steady reduction in the number of confirmed cases of the virus from July to November last year. This led the state to deploy a lean operational strategy by shutting down some of the isolation centers. However, over the course of the festive season, there was an exponential surge in laboratory confirmed cases of the virus. The positivity rate skyrocketed from as low as 3% on the 1st of December 2020 and went as high as 31% by the 31st of December 2020. Expectedly, there has been a rapid increase in capacity utilization of beds at the isolation center and treatment centers that we have, which has resulted in a significant increase in bed occupancy from as low as 4% before to as high as 70% over the last 4 weeks. This alarming trend has necessitated plans to reopen some of our previously established isolation centers, such as the Indo Isolation Center and the Bagada Isolation Center, which used to be the Cardio-Renal Center. It is our hope that this would support our efforts towards containing the rising case and flattening of the curve in the shortest possible time. Our oxygen strategy. The increase in the positivity of cases has necessitated the provision of a greater amount of concentrated oxygen for the moderate to severe cases on admission at our isolation centers. Over the last few weeks, the demand for oxygen has risen from 70 bottles of 60-liter cylinder per day to as high as 350 6-liter cylinder at only our Yaba mainland hospital. This is projected to even double, as we're expecting that we might have a need to up to 700 6-liter cylinders before the middle of February, towards the end of January into the middle of February. In addition to providing oxygen at our isolation center, the state government has decentralized the availability of oxygen across the state through the provision of 10 oxygen and sampling kiosks. This oxygen therapy and other related services will be provided to patients that require them. I'm glad to let you know that 5 of these 10 centers have been commissioned, whilst the remaining 5 will be ready within the next 3 to 4 weeks. And of course, it's important for us to mention that the 5 that has been commissioned are inside the MCC at Etiosa, the MCC at Alimosho. They are purpose-built oxygen triad centers. At Koka Aguda Primary Health Center, at Mushi General Hospital, and Isolo General Hospital. It is our expectation that this sampling kiosk will be easily accessible to residents that require oxygen therapy at the level of the local government and a stabilization point prior to their onward transmission to our isolation center if required. This strategy is to further increase our fighting chance of Lagos residents that have contacted the virus and require oxygen therapy. As a result of the increased demand of oxygen, the Lagos state government has commissioned the oxygen plant at Yaba Mainland Hospital, and we're waiting to receive in the next week or so additional 2. One will be sited at Bagada General Hospital, and the other one with a PPP will be sited at the Lasut Hospital in Ikeja. The one at Lasut should be able to produce about 200 bottles per day. The one at Bagada is about the same size as mainland, so it's about 60 to 70 bottles per day. We're also collaborating with some of our private sector. We've had discussions with some companies that can also help us scale up oxygen production, and we just signed up one, and we're expecting to get between 150 to 200 bottles from that single facility on a daily basis. What's been our vaccine strategy? We are closely monitoring the ongoing discussion by the federal government to procure vaccines for use in Nigeria. We have also opened discussions with various vaccine manufacturers so that when the vaccines comes eventually, we can ensure that Lagosians are well catered for. And so in the meantime, we are developing a strategy to articulate the criteria, the regulation, and the monitoring of vaccine framework for Lagosians. We also have what we call a private sector collaboration regarding our isolation centers and our labs. The Lagos state government is actively partnering with the private sector in the management of COVID-19 pandemic in the areas of testing, which I've mentioned, oxygen deployment, as well as the clinical management of moderate to severe cases. This partnership has helped enhance the state response to the ever-changing circumstances of the pandemic. In a bid to further explore the province's synergy that we see, the Lagos State government is currently reviewing the feasibility of a PPP for the management of some of our isolation center. It is our hope that this will expedite the reopening of previously closed center and also avail us the benefit of the operational cost efficiencies that experienced private sector management can bring to bear. So what we're saying is that we need to expand our reach, our scope, and our collaboration such that we can, we don't necessarily have to start and end it by ourselves, but with our collaboration and with our experience, we can get some of the private sector, public health, private health practitioners also on board with us. So what is our home-based care strategy? For those that may be asymptomatic or have mild symptoms that do not require admission into our isolation center, our telemed service called the Eco-Telemed has been deployed to assist in the management of residents in the comfort of their homes. Available to reach on this toll-free line is 08000 Eco-Med, 08000 Eco-Med, or 08000 356 633, 08000 356 633. The telemed service is manned by professional medical personnel to help nurse infected individuals back to health. They also have the ability to access the severity of patients' condition and facilitate the evacuation of worsening cases if need be. In addition, they also assist in facilitating the delivery of the Lagos State COVID-19 care packs, which contain items that can be supported affected residents. To date, almost 5,000 cases have so far been managed successfully by our Lagos State-owned Eco-Telemed platform. I enjoin Lagosians to take advantage of this service. I can tell you as your governor, I have tried them. And you can be rest assured that it's life. They have capable and professionally trained staff at the other side to be able to listen and take the complaints that you might require. So what also is the travel protocols that we need to inform ourselves again? According to the provisional quarantine protocols, all intending passengers must test negative of PCR from any country of exit within 72 hours prior to boarding. All inbound travelers are also required to register via the Nigerian International Travel Portal. Of course, the website is all known. Passengers must then fill an online health declaration self-reporting form located on that portal, which must be submitted online and printed for verification on arrival at any of our international airports. Passengers must also show evidence of payment, appointment for a repeat PCR test, following which they will be cleared through the Nigerian Immigration Service Migrant Identification Data Analysis System, MIDAS. Passengers' biodata page will also be forwarded to all COVID-19 PCR sampling collection centers to enable proper identification before samples are collected. Passengers must then proceed on a 7-day self-isolation and be present at the their own chosen designated center on the 7th day of arrival. Passengers that test positive after 7 days will either end up in isolation on the 8th or 9th day, while positive cases will be managed based on the national guidelines on COVID-19 treatment, or through the calls on our Eco-Telemed service for passengers that are residing in Lagos. In line with the approved obtained from the federal government, the PTF on COVID-19 through the immigration service, we hear that they will deactivate passengers or citizens who default in presenting themselves for PCR tests. It is therefore in the best interest of residents to provide correct contact details when registering online to facilitate effective and timely communication, tracking, and tracing. If you're in Lagos State and you wish to rebook your test or get your sample collected, kindly contact the Lagos State Biobank via an email as in info@lagosstatebiobank.gov.ng cbldetwork.com or our logistics arm on cbldirect@gmail.com. All passengers who has his or her passport deactivated will still have to fulfill all safety protocols before their passports can be reactivated. And I think this is important, because we know that some of the challenges that we've seen are people that have not kept, with those protocols, especially inbound passengers. That has also led us to the kind of numbers we've seen. I'll also just mention what we've done with schools. As you are aware, all schools in Lagos State have been directed to open in compliance with also the directive of the federal government, and they have commenced schooling activity yesterday, Monday, 18th of January 2021. This was a very difficult decision to make in light of the second wave of COVID-19. But I can assure you that it was the best decision for our children at this time, as their safety and long-term development, especially our most vulnerable children. We have considered all of the prognosis before we took this decision. The staff and management of the Ministry of Education, the Office of Quality Assurance in the ministry, have all been monitoring compliance of both the public and the private schools with the safety policies and protocols laid out. And I can assure you that on a daily basis, we will be monitoring the level of compliance and how things are turning out. And we're just hoping and believing that people will do the right thing. And so I want to enjoin parents to ensure that the protocols of safety are adhered to at homes, and that they model responsible behaviors for their children at all times in and out of their home. Just talk about the non-pharmaceutical interventions. In this second wave of the current pandemic, any malaria-like symptoms should be considered as COVID virus infection. And I'll repeat, in this second wave of the current pandemic, any malaria-like symptoms should be considered as a COVID-19 virus infection unless and until otherwise proven, either by doing a proper malaria test or by doing a COVID test. And so any infected individual with COVID-like symptoms should proceed to any of our public health facility and or laboratory to get tested. It is also important that we do not stigmatize or discriminate against anyone affected by this virus. Albeit it is highly contagious, this virus is certainly not a death sentence. And in most cases, seeking help early and quickly significantly improves the chances of survival from severe to critical cases. And I think this cannot be overemphasized, right? I mean, for you to escalate whatever the symptoms you have gives the medical personnel a very high likely chance of treating you and making sure that your case does not get into the severe model. It is important, therefore, that Lagos State residents begin to learn to live and act responsibly in order to augment our efforts and our previous success at flattening the curve. All residents are enjoined to do the following: wear a face mask everywhere. Ensure that you wash your hands, you wash your reusable mask regularly, and also properly dispose of used mask. If you operate an office or a business, insist on wearing masks before customers or clients can be granted access or be rendered service. And I think we can do this. People should just insist that those are the protocols in our office or in our environment. We also enjoin you to follow social distancing guidelines. Avoid mass gathering or adhere to published guidelines for congregation. Practice regular hand hygiene. If you feel any symptoms that correspond to the outlined symptoms of a COVID-19, the advice is you get tested. Testing is free for symptomatic patients in Lagos through our network of public testing facilities. If positive, self-isolate or report at any of our isolation center for follow-up clinics, or call our ECO telemed, where a medical personnel is on the other side, to also hear your complaints and be able to advise you accordingly. The Lagos State government will deploy effective messaging and education while rigorously enforcing all guidelines through the respective state agencies. We will continue to clamp down on all persons and organizations who flout the protocols and the guidelines we have established. So far, and I'm sure you're aware, a total of about 556 persons have been arrested for breaching the COVID-19 regulations, and 500 of them prosecuted and convicted to date. Whilst we have over 35 clubs and event centers haven't been sealed, the Safety Commission and the Lagos State Task Force will continue to carry out enforcement across the state and will not hesitate to bring errant defaulters to book. All places of worship are advised once again to register with the State Safety Registration Portal and to visit the portal regularly for updates on our safety protocols and conditions for operating. Similarly, our hospitality businesses, restaurants, hotels, and some of the event centers are also advised to continue to check the website and register, online with the Safety Commission and follow the guidelines. In the meantime, and until further notice, of course, nightclubs remain closed in the state. The responsibility of fighting and defeating this virus belongs to each and every one of us. And like I keep saying, the best response to all of this is for each and every one of us to take responsibility for ourselves and for our loved ones. Thank you very much. Well, thank you very much, gentlemen of the press. The first question is from Adiola. Civil servants stay at home, why school, and all the rest of it. So first is to clarify. It was a general circular that was internal. But more importantly, so what we've done is each ministry also has a calendarization. There's a roster of people that are within level 1 to 14 that are also allowed to come. But what they've done is that they've done a roster of people to come in. But the first thing we did was to say, what, everybody come. It's only when your name now appears on the roster that you have. So they have rosters of people that are also coming in. So it's not everybody, it's not blanket, but just to ensure that the enforcement is real. That's the first one. But internally, and you can go verify this, they are doing the roster system, and they're bringing in people, for that. And the reason is also because we realize that we cannot completely enforce social distancing also even in the office. And we also can use ourselves as a test model, right, to ensure that compliance, and we taking responsibility and using ourselves, as an example. And we're saying we've looked at the analysis, we've done analysis of our staffing, on grade level by grade level, and we've looked at, where is our critical component coming from, and we can take those decisions. I mean, I'm sure you've seen around, there's several levels 1 to 14 that are around even as we speak here. But like I said, it's based on the roster that each agency, each ministry, each office have come up with. And that's what, and it's really all around just ensuring that, the whole place is also not crowded. So at the end of the day, a ministry that has 100, can actually have a roster of having 30, 40 people, of those cadre, on a day-to-day basis, and that's a strategy. So it wasn't like an end-to-end blanket, instruction like that. But that has to go out first before internally everybody now do, a standard operation of what fits them and where are the gaps that they require. I mean, you don't expect that it will be level 16 that will be cleaning the offices. So they still require all of those things. It's not level 16 that will be driving all the buses. So they are in. But, it's just a model to ensure that, if your service is not required at a particular time, you also can take, at home. And you see, the flip side, with education is that, if you remember, what we're doing is that we're not actually even bringing all the children to school. So they're doing 1 day on, 1 day off. At best, it's 2 days or 3 days that They are coming to school. So we're not crowding the classes. We're also not crowding the pupils to come all at once. So they've also spread out, the numbers, and their furnitures have been well spread out to reflect that social distance. And why do we need to do that? There's something that we've not communicated. And it's the fact that last year, after the first lockdown and kids have to come back to school, we're still looking for about 24,000 children that have not come back to school. And so there's a challenge. If you keep them out for that long, their parents or their guardians now turn them to other things, right? Instead of ensuring that they still have time to come back and have a learning, even if it's twice a week, even if it's 3 times a week, at least it's been registered, he has a class, it's the beginning of a session, right? And you can monitor them. Once some of those things are in, we just don't want to throw them because they will just be roaming and they become endangered. You've seen incidents of, child abuse, all sort of, unprintable things that are being done to these children. So we believe to a large extent that school sometimes happen to be the safe haven for them, and we've done a roster in which will ensure that, they keep social distance, and we're monitoring. We have not said that our position is circumstant and it cannot be reviewed a week down the line, right? That is not an end-to-end. It's something that if we realize and we see that compliance are also not, people are not taking responsibility, we make a recall. That's why decisions will be reviewed from time to time, right? So join us in this conversation and let's see, how things turn out. We have also looked at the other side of it, and I can assure you that we're not unmindful of the science. We're also not unmindful of the social issues that comes with some of these issues, and so we had to balance some of these things. And I think I've also added additional steps, that we'll put there is to ensure that they are also spread out. You don't do 5 days in a week. They've all been rostered. Same with the teachers, same with the pupils. If you're in today, you're out tomorrow. And I've seen pupils like that. I've asked them questions, on the streets. Regarding BRT buses, we can enforce a whole lot around the BRT buses, and we're going to make, some of those pronouncements. But you see, the difference between the first and the second are this. During the first one, communication were not this high. People were also still not so sure if it's true or if it is not true. People were also not truly convinced that it's with us. Now, a lot more communication has gone into it. A lot more information, has gone into it. And so what I see is a lot more people take personal responsibility. And we'll continue to say, if you need not take a trip, if you need not go to somewhere, please stay back. Use other means of communication, right? You will need to be the one to take that active responsibility. Somebody is coming to your office, somebody is entering your car, somebody is coming to your shop, and the person is not protected. You have the right to say to the person the rules of non-pharmaceutical that has been enshrined, that government has said to, please go wear a mask. It's not only for me, it's also for yourself and for your loved ones. So that is the advocacy and communication that we're passing across and along. And we're working with NURTW, right? So if you feel and you say that this man is not compliant, please do take responsibility. Protect yourself. Protect yourself for yourself and for your family. And we'll continue to pass on this advocacy. The amount, of efforts and resource and interaction that we've had in the last 2 weeks to ensure that everybody in every nook and cranny of the state is aware, sees this, it's unprecedented, and we'll continue to do that, just so that we can get our people, informed. Get them informed and get them to understand that, if they do these things, they probably can just be avoided all of this calamity, and we can flatten this curve sooner than later. I think, same question, yes, but I think Channels was asking, how do we ensure that travelers, their test results and all of it? Well, there are consequences to this thing. I dare say that we're where we are now because of non-compliance of some people, right? And it's a double-edged thing. Government has set out regulations and says when you arrive, right, you filled your form 72 hours, 48 hours before you board. When you arrive, you should self-isolate. right? The family members of such people, they know fully well that this person has just arrived. They know fully well. So why can't you not insist and say to this person, self-isolate? That's the simple instruction that government has given. It's for your sake and it's for my sake, as your family member, as your friend, or as whatever relationship I have with you. That's number one. Number two is that in the event that you now, for whatever reason or the other, you couldn't identify or you couldn't get your sample, that's why we also put there for residents in Lagos, you can go back, to any of our sample collections, and get tested. As into the direct answers that if you don't, how would we know? Really, it's immigration. We do not have such access. We don't have such access to be able to see, to be able to monitor their biodata, But once the tests are done, the feedback are sent back, to that portal to show that indeed this person, is off the portal because test has been conducted. So it's the back end of it that, that's how it operates exactly. So it's the immigration service using the MIDAS platform that they have that will need to do that clearing, at the end of maybe day 8 or day 9, because this is still a federal controlled, system.